Hi everyone, welcome back to our channel, where we talk about health tips and life-saving advice that you really need to know. Today's topic could save your life or the life of someone you love. We're diving into some common medications that can make all the difference in the critical moments of a heart attack. It's shocking, but did you know that heart disease is the leading cause of death worldwide? Every year, millions of people experience heart attacks. But if you know which medications to have on hand, you could buy yourself or someone else precious time in an emergency. So please, stick around, hit that like button, and don't forget to subscribe if you find this valuable. Sharing this information could literally save someone's life. All right, let's dive right into it. When it comes to heart attacks, every second counts. The faster you act, the better the chances of minimizing damage to the heart muscle. That's why it's so important to understand what medications can help if you or someone near you experiences a heart attack. Let's start with one of the most common and probably one you've heard of. Aspirin. Aspirin is more than just a pain reliever. It's a lifesaver in the middle of a heart attack. Here's how it works. When someone is having a heart attack, a clot is usually blocking blood flow to the heart. Aspirin can help by thinning the blood, making it less likely to form clots and allowing blood to keep flowing. If you suspect you're having a heart attack, chew one regular 325 milligrams aspirin or 4 baby aspirins. Chewing helps it get into your bloodstream faster. Remember, though, you should only take it if you're not allergic to aspirin and you've consulted a doctor about it beforehand. Next on our list is nitroglycerin. This one is often prescribed to people who already know they're at risk of heart disease. Nitroglycerin works by relaxing and widening blood vessels, which helps reduce the workload on the heart. It's usually available as a small tablet or spray that goes under the tongue. In an emergency, it can relieve chest pain and improve blood flow to the heart. But keep in mind, nitroglycerin should only be taken if it's prescribed to you by a doctor, and you should avoid it if you've taken certain medications like Viagra within the past 24 hours, as combining the two can lead to dangerous drops in blood pressure. Moving on, let's talk about Clopidogrel, also known as Plavix. If you or a loved one has a history of heart disease, chances are you've heard of this one too. Clopidogrel is another blood thinner, but it's even more potent than aspirin in some cases. It's especially effective in reducing the risk of more severe clots that can worsen a heart attack. Often, doctors prescribe it alongside aspirin for people who are at a higher risk. If you're experiencing a heart attack and have Clopidogrel available, taking it can prevent additional blood clots from forming and reduce damage to your heart. Quick note, this is usually only recommended for people who are already on it under doctor's orders, so it's crucial to have a conversation with your doctor if you think it might be beneficial for you. Here's one medication you might not think about, but it can also play a role in heart attack survival. Statins. Statins like atorvastatin, fluvastatin, lovastatin, rosuvastatin, and simvastatin are commonly used to lower cholesterol levels. But did you know that taking a statin right after a heart attack can improve survival rates? Some studies show that statins can stabilize the plaques in your arteries, making it less likely for pieces to break off and cause a new blockage. If you're on a statin already, taking your prescribed dose in an emergency could help. Just remember, though, always follow up with emergency services immediately. This is just a way to assist until professional help arrives. Now, I cannot stress enough, having these medications doesn't mean you should delay calling emergency services. They're helpful, but they're not a replacement for proper medical care. These medications should buy you time, not be the only step you take. So, to quickly recap. 1. Chew a regular aspirin if you think you're having a heart attack. 2. Use nitroglycerin if it's been prescribed to you, and if you have no contraindications. 3. Take Clopidogrel only if you're already on it. 4. And lastly, statins can provide added support if you're already prescribed one. It's so important to share this kind of information. You never know when it might help someone in a life or death situation. So please, if you found this helpful, hit that subscribe button, give us a thumbs up, and share this video with your friends and family. By doing that, you're helping to spread knowledge that could actually save lives. Thank you for watching, and remember, your health and safety come first. Take care of yourselves, and I'll see you in the next video.